We'd like to welcome everyone to our fourth JBI Live webinar in our series, Using Evidence, Providing Clinical Care, a Practical Approach to Implementation with our speaker, Dr. Kylie Porritt. It's an absolute pleasure to have you join us today virtually from wherever you are around the world. And my name's Alexa MacArthur. I'm a Senior Research Fellow here at JBI. I'm also a midwife and I'll be your host for the webinar today. As we get started, I would just like to do an acknowledgement of country. So I'd like to acknowledge that we are delivering this webinar from the lands of the Kaurna people. I also acknowledge the traditional custodians of the various lands on which you all work today and the Aboriginal and Torres Strait Islander people participating in this webinar today. I pay my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connection to the lands and waters of Australia. So just before we get started today, I would just like to run through some of the logistics for the webinar. We do want this webinar to be as interactive as possible. And even though all of you as participants have joined in the listen only mode, but you are able to interact using the chat function along the bottom of the Zoom bar. And we would encourage you to make comments during the presentation. You're also able to ask questions using the Q&A function on the Zoom bar. And so if you do have any formal questions for Kylie, please do enter them via the Q&A and we will be having some question time at the end. And there will also be a recording available after this webinar, which will be available via the JBI YouTube channel. So if you are aware of other people who have missed out today, please direct them to that link as well. Now, if you are a person who enjoys using social media, we would encourage you also to use Twitter during this webinar, and here are some details with the hashtag JBI Live and also our Twitter handles as well. So if you're a person who is that way inclined, please feel free to get onto Twitter. So I'm very excited about our topic today, especially in this year of the nurse and the midwife, and I would like to introduce our speaker today. So Dr. Kylie Porritt is a Senior Research Fellow and a nurse who works here at JBI's Implementation Science program. She's been an active contributor to the field of evidence-based healthcare for over a decade. She's an experienced published researcher, having been involved in the conduct of multiple systematic reviews and various health-related research projects. She has a particular interest in developing methodology for the synthesis of qualitative evidence and has played an integral part in the development of meta-aggregation, which is a JBI approach adopted as a method for qualitative synthesis, and also ConQual, which is a method for assessing the confidence of qualitative evidence. In her current role, she's the program manager of the implementation science team and also the academic lead for the cardiovascular care and the emergency and trauma specialty. She's also chair of the implementation science methods group. She's a passionate advocate for evidence-based healthcare and the implementation of evidence into clinical practice, and also an excellent colleague and friend. So I'll hand over to Kylie now. I'm really looking forward to your presentation, Kylie.
Thank you, Alexa. It's really wonderful to be here talking to you today and to everybody else, especially about implementation, which is something I'm extremely passionate about. But before I get started, I've just put up my list of disclosures, so I'll let you just all read through that. I guess the main point is that I am a research fellow here at JBI, and so obviously what I'm talking to you today will have that lens and a JBI lens through it. So just as a bit of an outline of how the next hour or so is going to go, Alexa and I will sort of be trying to engage with you as much as possible. As she said, please use the chat. We'll just sort of touch on the current state of where implementation is in healthcare, try and provide some sort of practical considerations or approaches for you to think about when you're conducting your implementation report, and also linking you to some resources that you can actually go after this webinar, go off and read and learn a bit more about. And then at the end, we'll have some time for some Q&A. But before we get started, we want to just start with a poll just to sort of see where you guys, what level of involvement you've had and sort of where you're coming from for this particular over this next hour. So Alexa is just going to put up a poll.
Yep, so we have two parts to this. There's two questions here. So what is your role with evidence implementation? And if it doesn't quite fit, choose the one that's closest to you. And then just to scroll down, the second question there is, what have you used when you've tried to implement a new guideline or evidence into your clinical practice? So we'll give you just a 30 seconds to fill out those two polls.
It is, we all do come from it from different perspectives, so it is great to get an understanding of where everyone is coming from today.
Just give you a few more seconds to answer that before I end the polling. Yeah, so it looks like we have predominantly, we have a bit of a mix here, but we have quite a few researchers on the line, which is great as well.
And then an even still of organisational unit managers. And predominantly adopted a model, a theory, or framework. So that's great. Okay.
Excellent. Thank you.
Okay, so we'll just move on. So what is it that we're actually talking about today when we're referring to implementation? Implementation is not a new concept. It's been something that clinicians and healthcare professionals have been discussing for decades, talking about the challenges that they face in getting that research evidence into practice. What we have seen is that over sort of the last, more recent years, the science behind implementation has really evolved. And if you have been involved in implementation, no matter what level, you may have heard a lot of different words being thrown around. So there's, evidence implementation, translational research, evidence transfer, knowledge mobilisation, and there is a whole range of different terminologies that generally try to describe that movement or transition of knowledge or research evidence into some form of practice. So they might have slightly different meanings for different people in their context, but the overall goal for everybody really is about getting the research evidence into practice. And so this slide is just what I touched on before. As I've said, the science behind implementation has really started to evolve, and what we see when we talk about this broad umbrella term of knowledge translation or this movement of research into practice is that it sort of branches off into two separate fields. So one of it, the science part, is where the implementation scientists or translational researchers are really looking at the scientific method of how we go about conducting implementation, and they might focus on what methods are meant to be, are the best available methods to use, what are the barriers, facilitators, really focusing on the how-to part. And the other side of implementation is more the process-orientated part. So this is really about sort of the core set of activities that really are focused on acting upon how to actually go about doing implementation. So this is what I'm hoping to touch on today with you, is providing some practical solutions and thoughts for you to consider about when you're acting on your in your implementation project, the types of things that you need to do for it to be successful. We have also, when we talk about research and practice, we often talk about this research to practice gap, and most of the time it's sort of estimated that it takes around 17 years for a piece of research to actually be embedded into everyday practice. And for me, I think that's just extremely too long a time, and the implementation scientists and translational researchers, what we're trying to do is really try and shorten that gap between research and actually getting it into practice there. But we do find it quite challenging, and there are a number of barriers that people face. I think here we're just going to put in another poll for you to do. I'll just pass back over to Alexa for the poll.
Okay, yes, here we go. Just a minute, sorry. So, so you should all be able to see this second poll. So what has been the most common barrier in your setting when you've tried to implement something new? And there's just a few options there for you to choose.
While you're doing the poll, when we talk about the practice, there's been some studies to show that sort of in the US and the Netherlands that people who are receiving practice, they're only receiving effective practice about 50% of the time, and that some of the around 20 to 25% of the time, people are actually receiving inappropriate care. And this is the same for us here in Australia. There was a more recent study that came out that showed patients were receiving 57% of the time were receiving appropriate care that was aligned to best practices. And interestingly, out of that particular study, it was shown that certain conditions actually do a lot better in aligning with practice. So for cardiovascular care or the management of coronary artery disease, they were shown to align with best practices 90% of the time, whereas there were other conditions such as alcohol dependence where they were less likely to be aligned to best practice, and I think it was around 10% of the time. So we really are trying to work towards closing this gap and ensuring that our everyday practices are informed by the best available evidence.
Okay, Kylie, I'm just going to share the results of this poll. And you can see there's a bit of a spread across the board with these ones.
Okay, so we have lack of leadership, lack of time. And what's really interesting to see there as well, I'll just close that poll, Alexa.
Yep.
Excellent. I'll just move to the next slide, sorry. Sorry about that. There we go. Is that a lot of those, we can see that there's a broad spectrum of barriers that people are identifying with. And that's what we see in the research as well, is that there are these common barriers. We will always find that specific settings and organisations will have their own unique set of barriers, but generally there are these common barriers that are consistent across all organisations trying to implement evidence into practice. These relate to knowledge, so this might be a lack of understanding or a lack of an awareness that the evidence exists, or even just a lack of understanding of how that particular evidence relates to them in their particular practice. It can also be grouped into attitude, so this is sort of people that might have a lack of motivation, they might not see it as they've been practicing this way for a while, they don't need to be changing their practice. They might not sort of understand what is expected or how the outcomes can be improved, so their attitude towards the project can often be a barrier. The barrier related to evidence, sometimes it can be around the developing and establishing the evidence. They can be quite complex to read. The layouts can be a little bit difficult to be able to work out how to apply that particular recommendation in your local setting. And a lot of the challenges that are highlighted in there tend to relate to when you have patients with multiple and complex illnesses, and how a specific piece of evidence is going to apply for them. And then this is the external barriers as well, and so this is what we commonly see as a lack of resources, a lack of organisational support, lack of engagement between everyone. So yeah, it's a challenge for everybody, and we're going to try and work our way to get over it. In regards to how implementation projects start, we often have people driving it, and different people can drive an implementation project. So we had quite a number of researchers here listening to us today, and so that can be some of the drivers of the implementation. It can be research driven, so you may have received some funding to conduct a piece of research, you may be trying to develop or implement a theory or model, and some of the criticisms around sort of research driven implementation is that it can be quite complex for people to embed into their everyday routine practice, and when that research finishes, the practice isn't sustainable. Other ways of drivers is a clinician-driven one. So this is sort of what we would commonly see here through our implementation programs, is a single clinician who's passionate about a topic and wanting to make change within their local setting. That's great, it's fantastic to have that motivation. But the challenge with that too is that implementation is not going to be successful just from one single person. It takes a team of people to be involved. So if that person happened to move from that area, it might not be as successful. And organisation-driven implementation is, some of the criticisms for that is that it tends to be sort of this top-down kind of approach, that someone up high has come up with this idea of we need to change practice in line with this, and there's been no engagement at the local level. So you're not having that buy-in from people. So what we're hoping to try and do today is just give you some useful tips to be able to think about your implementation projects. I think for many of you, if you're healthcare professionals, you'll be very familiar with the 5 rights of medication, which I think now is 7 rights. But I wanted to frame so you've got sort of a key takeaway message that you can sort of easily remember. So I'm just trying to frame what's important here for successful implementation around the 5 rights. So I'll be talking about the right reason, the right evidence, the right people, the right environment, and the right process. So the right reason, this is extremely important, and I would love for you to use the chat and let us know if you've been involved in implementation, what some of the reasons were, how did you come about starting the implementation project. It really is about identifying the problem that is actually occurring. And there are a number of different ways in which this can be done. It can be that there might be a particular intervention that is used quite a lot, sort of very frequently in your clinical area, and you're wanting to make sure that it is because it's so frequent, that it is the best possible intervention to be used, it is aligned with best practice. Sometimes it can be things like if you've got poor outcomes, so for example, if you have high falls rates in your area, that might highlight to you as an area that is a problem area, and you want to try and reduce the number of falls within your area. So you might look at how you can, what best practices are around in falls prevention. They can also be driven by there being a national or local request. There could be new evidence that has come out, and that can be the driver for you as well. But it's important to be, when you're thinking about the reason that you're doing it, start thinking about what the benefits are in doing this project, because projects can, they do take a lot of time and people's energy. So you want to be making sure that you're using that time and people's energy efficiently, and that there is going to be a benefit to the patient and to the organisation as well.
Kylie, one of the comments that's in the chat has just come up around it being that sometimes in poorly recognised conditions, implementation is often consumer driven, which is a really valid point. So you've mentioned that there as well. So yeah, so that's good to consider.
I think with everybody having easy access to patients having much more easy access to information too, I think the consumer driven has probably increased a little there too. So the other right is making sure, so you've identified your area, you really want to make sure that you're using the right evidence to inform your practice there. And when you're looking at, what is the right evidence, you're wanting to be using evidence that has been developed using has a rigorous methodological process, that the quality of that evidence is considered to be high, and that those recommendations that are coming from that evidence, you're going to be able to apply them appropriately into your area. And so when I talk about the sort of, the appropriateness and the feasibility of the evidence, sort of what comes to mind is that, if you're in a setting where the evidence shows that a patient has come in and the best available thing is for them to have this scan done that uses this expensive high-tech piece of equipment, if you are in say a rural or remote or a low-resourced country, you might not have access to that particular resource, and therefore you're not going to be able to align your practices with that. So it's about identifying your topic area and then ensuring that you're following through with the evidence that is of high standard and is appropriate for your setting. And for us here at JBI, we have our audit criteria that we use, or what we use to develop our compare our best practices against, are informed by our JBI evidence summaries. So I've just put up an example of what one looks like here. This is an example of a hand hygiene evidence summary. It's available on our JBI website via the COVID-19 special collection. And so our evidence summaries are developed. There is a sort of a short, succinct summary of the evidence, but they are developed using a rigorous process of a search, a critical appraisal, development of best practice recommendations that align back to the evidence. And we have a two-stage peer review with experts in the field to ensure that that's appropriate as well. And from our recommendations, this is what we use to develop our audit criteria, and that sort of is our quality indicator, or our standard for best practice. So when you're thinking about the developing, obtaining the evidence for your area, you're wanting to be sure that you're using not just a single study and a recommendation from a single study that perhaps wasn't done very well. You really are wanting to make sure that there is the methods behind it to ensure the quality is there. Okay. And then, all importantly, I mean, implementation cannot be done without people. So, and I think, you know, there are plenty of examples out there of needing to have the right people involved. And so when you've got the right people involved, you are more likely to have a successful project. So I've tried to just sort of categorize them here into sort of the different types of roles of people. And really, when you're doing an implementation project, it's really important that you involve people at all different levels. So this is at the local level, you're getting clinicians and champions with you on the ward area that are going to actually be able to engage and really be a champion for you on this project. It's also about making sure that you've got the right people at an organisational level, as well as those policy and decision makers. And there's all different types of roles. When you read in the research, they can be called decision makers, the researchers, even involving with the researchers themselves. So they're the ones who are actually doing the research, developing what the best practice evidence is, making sure there are key facilitators as well. So you really need to be thinking about engaging with people that have the right skill sets to be able to help your project succeed. And then not only just the right people, but you want to make sure that they've got the right characteristics or qualities as well. And so I've got a few listed to the right of the screen. But for me, the most important one here is you're looking for people that can communicate well. Communication is one of the key aspects of a successful implementation project. You need to be able to people need to be able to communicate any changes that are made, have any voice, any opinions or concerns. So that's what you need to be looking for when you're looking for the right people there. So we've touched on the right reason, the right evidence, the right people, and you need to have the right environment. So this we're really looking for here is for successful implementation. You're looking to make sure that your environment, your context is ready to undergo this change process. So this is like about a readiness for change. And this is across all different levels. So here we talk about the local, organisational and external. It has also been referred to as the micro, meso and macro levels as well. So there might be some terms that you're familiar with here, but it's essentially looking at making sure that you've got the right structures in place to help for this project to succeed, that you've got the right leadership, that there's capacity for the change to be occurring. So it's really quite important that we are able to evaluate what our environment is before we get started, and it does allow us to try and succeed more successfully.
So, and I was just going to say, Kylie, in this around the right environment, well, is the right timing to be introducing an implementation program of work. And especially, I think in this current climate this year with COVID-19, there's been a lot of different organisations that we've been in contact with that may have planned to do a particular implementation program, but COVID's really interrupted that. And so you have to obviously factor those sorts of things in as well.
I think timing is a key component to it as well. So that's very, very true. So our last right for successful implementation is making sure that you adopt the right process. And what research has shown is that when implementation projects or change practice is likely to be more successful when you have followed a structured process as compared to an ad hoc kind of process where you just sort of make it up as you go along. So it is really important to focus here on, ensuring that you've got a clear process and people understand what their roles are within that process, that you're clear on what it is you're going to do, when you're going to do it, so the timing is of importance here, and also that your process embeds in some kind of evaluation as well. So it's not a matter of just saying this is how we should be doing it. You're actually going to be incorporating an evaluating the practice, learning from that as well. So we really need to be, it's essential then for us to, when we're going to think about selecting the right process, choosing the right process for us, the importance of understanding your environment and knowing the people that you're working with, so the right people in the right environment, they really should become really quite evident here, that you actually you need to have a really good understanding of those in order to be able to move forward with the right process. So we have there are many different models, theories and frameworks that people can follow in regards to when they're adopting a implementation process. So I'm not going to go into a lot of detail on all of these here, but there are a lot out there, and it is a matter of finding the process or model that will work for you in your environment. And these are aimed at different levels as well. So some sort of aimed at the more novice person undertaking an implementation project, and then there are other theories and frameworks that are a little bit more complex if you've been involved in implementation for a while. But here at JBI, I just sort of want to take you through sort of, what our approach to evidence implementation is. This is the model for the JBI model for evidence-based healthcare, and this is how we conceptualise evidence-based healthcare, but the orange web is how we conceptualise evidence implementation. So the model itself just starts and ends with global health, which is what we're all trying to do here. We're trying to improve practice, improve outcomes for patients, and it works its way through the evidence-based healthcare cycle. So this generation of research evidence, the synthesis of that evidence. So this is here when I was talking about having the right evidence. So, synthesizing that information, disseminating that information out by evidence transfer, and then actually going through the process of implementing that into practice. And when we look at the implementation wedge a little bit more closely, the three key factors we have highlighted there are context, facilitation, and evaluation and process. And I think you can see how that aligns well with the 5 rights that we've just been speaking about. So it's really important to understand the context in which you're delivering your implementation. So understand having the right environment there to start it, to have people working with you that are going to be facilitators of change. So really understanding the people that are involved, and then using that structured process. So, we look at our definition of evidence implementation, and it is this purposeful and enabling set of activities. That is what you're wanting to achieve. When there is a structured process that includes an evaluation component, you are more likely to be successful. So the model is how we conceptualise evidence implementation, but our framework here is how we sort of our pragmatic approach, how we can practically go about doing implementation. And so it's very much embedded in an order and feedback cycle. So and you can have a look at, when you're looking at the steps that are here, they do align again similarly with the 5 rights for implementation. So it's about step 1, identifying your practice area, so ensuring you've got the right reason, engaging in change agents, step 2. Step 3 is around the evaluation, assessing your context, so understanding your environment, and 4 and 5 is about reviewing your practice against those evidence-based criteria. 5 I'm going to talk about in a little bit more detail in the next slide. And then this model sort of ends on that it's this ongoing cycle of reassessment, ongoing evaluation, and that's what's going to help with sustainable change for you, and that you do need to have some structures and processes in place for the implementation to continue going on, rather not just finish when the project has finished once. So I just wanted to highlight here what our step 5 was about, which is our getting research into practice, or we commonly refer to it as our GRIP method. This is a really useful way for people to be able to identify the barriers and enablers of what's helping them achieve and align with best practice, and sort of highlight what perhaps they can work on. So the GRIP method it's undertaken in 3 stages. The first part is that evaluation of your practice to what the best practice standards are, or the quality criteria are. And then working with your key people, your key stakeholders, you look at what you've done well and what you haven't done well, and then try and work out, why it is that, we've done this component really well, but we didn't do as well at that. And you're identifying those barriers and enablers, those facilitators for utilising that evidence. And once you're able to do that, you're then able to then focus on developing strategies that will either enhance the facilitators or will help overcome some of those barriers. So it's a really useful process for people to go through. We talked about, obviously identifying those barriers and enablers and aligning your strategies to that. I didn't want to focus too much today on all the different types of strategies, but I did want to just highlight that there are many different strategies out there. Reminders, which just is a mental, might be a memo or a note to remind people to practice in a certain way, or just keep the topic in the forefront. There's order and feedback. I think sort of some of the most common ones is what people have probably used are around education. But what we're seeing really is that not one particular strategy is going to solve all of your issues. You're really going to need to use a multifaceted approach to getting research into practice. So you might find that you're using two or three different strategies. What I just wanted to do here is I just wanted to show an example of how an implementation project, how you can see how it fits in with these 5 rights of evidence. So this is a project that Alexa was heavily involved in. So Alexa's going to talk us through that. So I'll just pass back over to you, Alexa.
Thanks, Kylie. And I'm just keeping an eye here on some of the questions that are coming through, and I'm hoping this exemplar will help to answer some of these questions as well. So this was a project that was done at a large tertiary hospital within an Australian state, and the focus of the project was around delirium, and this had been identified as a national focus to try to help manage delirium early and to look at assessing delirium, preventing delirium and managing it. And there was local support for this topic from the tertiary hospital, because they had high rates of delirium in the year preceding, and obviously we're having some adverse outcomes associated with delirium. So as far as around the evidence part of that, there was obviously very good guidelines and best practice recommendations coming through from the Australian Safety and Quality Healthcare Standards, and there were actual delirium clinical care standards. And so there was audit criteria could be quite easily identified, and those audit criteria were then being able to use to measure compliance with the various standards. Now, importantly, in this healthcare organisation, the people involved in this, there was excellent senior leadership support, and they were very proactive and promoting this. They then enabled participants to actually self-nominate. So people who had a particular interest or passion around delirium care and were put themselves forward as participants, so that it wasn't anybody sort of being tapped on the shoulder and told that you must be involved in this project. People were willingly putting their hand up to get involved, and then leadership also were protecting time for them to spend on this implementation program. So that really also really helped. JBI do run an implementation training program, and then there were two facilitators from JBI who were working with this group of health professionals over the course of the project. So as far as looking at factors around the environment, certainly there was a lot of groundwork that was done prior to a baseline audit being undertaken, and they were looking at and considering things like the resources that were available. Certainly they worked hard to build a project team and a multidisciplinary team of stakeholders. The workplace culture at this organisation was excellent, but that certainly is something that can be very challenging if there isn't a good workplace culture. There was excellent communication and you know, monthly team meetings, people checking in, email communication, so that people were all across and understood where people were up to with the project. And certainly at this organisation, there was a very high quality commitment to quality management. So the process, we did use the JBI Evidence Implementation Framework, which is grounded in the audit and feedback process, as Kylie's already outlined. And certainly then over the course of the ensuing months, when they did a follow-up audit, they did show greater compliance, and Kylie has a slide coming up with that. But they were also then able to collect outcomes around rates of delirium as well, which showed that they'd been able to decrease those delirium rates.
Thanks, Alexa. I think that was it's a really good example, this project, of just how when people are working together in a collaborative way and people's roles are clearly defined, how you can gain some success. So I did want to show from this, because what I really like that is I mentioned before in the previous slide about our group method, and I just wanted to show what it can look like when it's presented in a table. So I'm not going to go through the specific details of what their barriers and strategies were for the delirium project, but just highlight that the group method allows you to sort of visually connect and see so you identify your barriers. You're looking at then working with your stakeholders in your group to develop some strategies that might then feed into some resources that you might need to develop, and you're very clear on what the outcomes are for that. So it is a really useful way for people to think about that, the implementation strategy component of, you know, what strategy is going to really aligning and with where your needs are. And as Alexa mentioned, I just wanted to show the results of the delirium project. So the blue colour is obviously their baseline practice, and the yellow is after they've gone through the implementation phase and they've addressed their barriers and implemented some strategies to change practice. They have then looked at their area of care, and that's what the yellow highlights there. So a successful project. Well done, Alexa and team. So when we're talking about you know, implementation projects, it really needs to not just be this once-off, we do this project and then go. What we really need to be thinking about is the sustainability of this practice change. And when we're talking about sustainability, we are really talking about this sort of seamless and sustained integration of evidence and best practices into our everyday routine practice. This is very much an area that is rapidly evolving, sort of over, you know, just over even these more recent years. And so there's not a lot of very clear guidance, I guess, on, you know, how to go about doing sustainable change. But I think what's really important for me is that and what's highlighted in these papers here is that it highlights that we need to be really clear about what our roles and definitions are, what the expectations are of the project. And when you have those really clear roles, it is more like, and expectations, the project is more likely to be sustainable. That it must include this ongoing evaluation process. So it doesn't just stop with the research project, it embeds processes in place that continue on once the research project or once the clinician has left, that it embeds it into practice. And importantly, it also highlights the need for the process to be adaptive. So it's not doing the same thing over and over and then wondering why the results aren't changing. What you really need to be doing is learning from both your successes as well as your failures, and then adapting that process and improving along with it. So these are just some useful papers there that you might like to go and have a read if you want to learn more about sustainability as well. So I think what today has probably shown is, you know, that the reality of implementation is complex, and it's very context dependent. So we've talked a lot about understanding our environment, understanding the people that we work with and the people that we need for our project to succeed. And, you know, we do need we need people that are good leaders, good communicators in order for the project to succeed. While it is a very complex, messy kind of process, I do hope that the 5 rights for implementation as like a bit of a take-home message for you, that if you just think about those different 5 rights and what you need in your particular setting to succeed for your project, I hope you can take that away with you there. And I also want to just end as we're sort of getting towards the end of this presentation, is I really just want to give you some resources that you can link at. So it's not just listening to this 1 hour about implementation, but that you can now, you know, after this webinar, go off and read some more. So these are some sort of key papers that where people have published around the implementation field. There are many, many out there, but it is good just to have a start. If you're not sure what approach to take, that first paper that's right at the forefront of your screen, that sort of helps you in selecting what kind of approach might be appropriate for you in your particular project. Likewise, I think just reading about other implementation projects is really useful. Understanding what strategies other people have implemented if they're looking at a similar topic for yourself is also a useful way. So I'm happy to share any other resources and publications if people want as well. Also, I just wanted to highlight is also for JBI, we have an JBI manual for evidence implementation. This is freely available to everybody, and it is very much framed around the JBI implementation framework. So the website link is there for you. It's divided into 2 sections currently, with the first section sort of introducing you into implementation and implementation science, and the second section is really going into a lot more detail about that framework, which I've only just touched on today, those 7 steps within the JBI implementation framework. So if you're wanting to know a little bit more or understand each of those steps and components more, this is a really useful resource. I suggest bookmarking it in your browser would be a good way to go. We also have some implementation projects, and Alexa is involved in the implementation team, so she delivers a lot of these projects. So do you want to touch base on what these 2 resources are?
Yeah, sure. So JBI, for a long time, we have been running evidence implementation training programs, and we also are developing or reimagining, I guess, and offering a JBI evidence implementation workshop as well, which is over a shorter period of time. But our training program, we do work very closely then with clinicians, and we run that program generally over a 6-month period or more, and offer facilitation support during that time. So if that's something that you are interested in or would like some further information, please have a look at our website, and you can also email our education team as well.
The other thing I just wanted to bring to your attention today is the JBI Evidence Implementation Journal. So this is a really useful resource, so I highly recommend subscribing to the table of contents to this. It can give you some useful information around methodologies around implementation, but also, it also publishes implementation reports. So you can actually, I think just from reading other people's examples of the challenges that they've faced, you get more of an understanding of what you might need in your particular area as well. They also have, there is a Twitter account associated with this journal, and it really is becoming this sort of network of people who are passionate about implementation. So if you are passionate about implementation as much as we are, it would be great to be able to have some conversations and be able to, on a regular ongoing basis, be able to share some resources with you. So useful to be checking that out as well. And then just to sort of to end the webinar today, just really wanted to say that, it doesn't really matter where you're coming from. Like if you are a clinician just starting out and wanting to learn about how to change practice in your local area, or you're a healthcare organisation wanting to do multi-site projects, or you're a researcher wanting to work out how to get funding and engage with other partnerships about it, we all need to start somewhere. And I think sort of hopefully I've been able to direct you to some areas where you can gain some further information. Remember sort of the five rights, so there's those key areas that we need to be thinking about if we want to successfully and sustainably implement and change practice for the longer term. But really it is about our journey being this lifelong one. It's not this one stagnant approach, it is our lifelong journey for implementation. So we hope you can keep on that journey with us. And so I think that ends it there. So I hope you found that interesting, and I think we're going to flick back over to Alexa for some questions.
Okay, thank you very much, Kylie, for that excellent presentation. And, we do appreciate it's a short time frame, and so you've really taken us for a whirlwind journey through implementation. So thank you very much for that. And we do have some questions here. So hopefully some of them have already been answered through the course of the presentation. But I just have a couple of questions here. So Kylie, one here that says, what's the best source of evidence for implementation and why?
The best source, I think it really does depend on your topic area, I would say. But I think this comes back to what I was saying before, is that when you're looking at the evidence to inform your practice, you're really looking for the best available evidence. So for us, from my mind, it would be evidence-based guidelines, it would be findings from systematic reviews, but we also take, at JBI, we take a very broad view of what constitutes evidence. And so if you have a topic area where there are no systematic reviews to tell you what the best available evidence is, and there are no specific evidence-based guidelines developed, then it may be that sort of consensus expert opinion it forms the best available source of evidence for you. So it does really depend on the topic area that you're interested in.
Yeah, thanks, Kylie. Now there's another one which is kind of interesting, but are there examples of good strategies for culture change? I don't know if you want me to have a go at answering that one, Kylie.
Well, I mean, the Delirium, I think, was a really good project for that to be able to talk to. So
yeah.
Yes.
Yeah, and I know that this can be really, really challenging for clinicians. They may have some, very, clear or excellent guidelines that they're trying to implement, but maybe their workplace setting there is quite a negative culture of people saying, well, why do we need to change? I've done it this way for many years. I'm not really interested in learning what the latest or the new evidence says. And I think this can be a real challenge. I mean, there are obviously some different, organisational theories around culture change, but the research is very clear that it's a very difficult thing to change workplace culture, and it happens quite slowly. That's something that we actually spend quite a bit of time on in our evidence implementation training program, but there are some very good references as well. So have a look at our implementation manual for evidence implementation, if that's something. So I'm sorry I can't give more of a, in a short time frame, an answer for that one.
I think behaviour change is definitely a complex task. You know, it's definitely difficult to try and change behaviours, but it's I think it's really important that we consider, you know, we evaluate what is actually going on from those social and clinical sort of norms within your area, and find ways. We need to be working together to find ways to address that. So
another question here. So what do I as a clinician gain by getting involved in implementation?
You gain everything. It's look, for me, I think, you know, if I'm a nurse by background, and I think as clinicians, we want to provide the best for our patients, and I think that's what implementation does. Is it really allows us to ensure that we're providing the best possible care that's going to give the best possible outcomes for our patients. So for me, that is the end point. Obviously, we need to, you know, in achieving that end goal of improved patient care or global health, we need to develop the science and develop our understanding. So this is where the theories and frameworks come. But for me, the focus is, you know, this is why you would get involved, that you want to do good for healthcare generally. So it might be a bit of a big task, but you know, I think that's essentially the core of what we all are trying to achieve here.
And I'd also add to that too, Kylie, is that certainly what we often see with maybe clinicians that have been quite experienced, or maybe are feeling a little jaded in their workplace, that getting involved in implementation work and really understanding, reading evidence and thinking about how they can implement that and bring teams of people along, it's almost like a light bulb moment, and they really are often re-enthused and re-motivated, you know, so I would strongly agree with you, Kylie, and highly endorse for you as clinicians to get involved in implementation work.
And I think the key is, you know, if you're a clinician and you're getting involved with implementation researchers, you're all learning from each other. So I think that's what's really useful about this idea of an implementation network, is that we can all learn from the challenges that we face, and we all come from that, from different perspectives. And I think that's the only way we're going to really truly be able to succeed in implementation, is through this collaborative approach of talking to each other and learning from each other.
I'm just having a look here. I think that's probably all we've got time for question-wise. So at this stage, so thank you once again, Kylie, for that. And if we can just, you know, and we'd just like to say a very big thank you for joining in this webinar. It's obviously it's a huge topic, and we really hope this has just, you know, really whet your appetite for having a little bit more of a think and look into the JBI resources. And we'd really strongly encourage you to get involved and to keep furthering your implementation journey as well. And so please do feel free to link in on our website, and obviously have a look too at our JBI YouTube channel. At the end of this webinar, there will be an evaluation link with a very, very short survey, and we'd really appreciate if you could you know, give us some feedback as well. And also to contact our education team if you need to do that. So we just would like to give you a quick heads up about our next JBI live webinar, and this will be on the 20th of October, and we're really delighted to be featuring Professor Ian Graham from Canada, and this will also kickstart our World Evidence-Based Healthcare Day, which is happening on October the 20th as well. So we would really love you to get involved. There's some links here, a website as well. And so we'd love you to check out, see how you can get involved. You may want to actually submit an impact story, but please, you know, book this date out, and we'd love you to join us in celebrating World Evidence-Based Healthcare Day. So thank you once again for taking time and joining with Kylie and myself. Thank you again, Kylie, for an excellent presentation, and we look forward to to future webinars. So thank you very much, everybody.